Hey guys, I'm Kayla and welcome to Kayla Tailored Wellness. So I am a family nurse practitioner that specializes in integrative medicine. So what that means is that not only do I get to treat traditionally in the healthcare clinic, but I also get to educate on lifestyle changes, disease prevention, and treat with supplements, herbs, and botanicals. So today I want to discuss hypertension, which is otherwise known as high blood pressure. I want to review what causes high blood pressure, symptoms of high blood pressure, how I would treat it pharmacologically in the clinic, lifestyle ways to decrease your blood pressure, and natural ways to treat your blood pressure. But first, smash that like button and hit the subscribe button for the YouTube algorithm. Just remember, I am not your healthcare provider. I do not know your allergies. I do not know your past medical history. I do not know what medications you are taking. So use the information you learned today to have an educated conversation with your primary care provider. So many people do not even know they have high blood pressure. They live their daily lives with this hypertension. Sometimes people do come to the clinic complaining of headaches, vision changes, dizziness, chest pain, or shortness of breath. Causes of high blood pressure include genetics, obesity, lack of physical activity, high salt diet, smoking tobacco, drinking alcohol, and deficiency in magnesium or potassium. A medication I may use to treat blood pressure would be the ACE inhibitors, otherwise known as the angiotensin converting enzymes. These medications end in pril, P-R-I-L, and this includes like Lisinopril or Benazapril. So what they do is they help relax the blood vessels and decrease the blood volume, therefore decreasing the blood pressure. Side effects would include a dry cough. Another blood pressure medication I may use are ARBS, Angiotensin 2 receptor blockers. So these medications end in sartan, S-A-R-T-A-N. So this includes Losartan, Valsartan, and what they do is they also help relax the blood vessels, therefore decreasing the blood pressure. An additional treatment for high blood pressure would be calcium channel blockers. These include amlodipine, nifedipine, and verapamil. These work by blocking the calcium from entering into the cells into the heart and arteries. And by blocking this calcium, it helps the blood vessels relax and open, therefore decreasing the blood pressure. Side effects would include lower extremity swelling. Furthermore, you can treat blood pressure with beta blockers. These medications end in LOL, such as propranolol or labetalol. So these help decrease the heart rate and decrease the force of the blood coming out of the heart, thereby decreasing the blood pressure. Side effects would include fatigue or dizziness. The risks of untreated blood pressure include heart attacks, strokes, heart failure, kidney damage, and brain aneurysms. Lifestyle ways to treat high blood pressure would include losing weight. So this visceral fat that can be on the abdomen can be very inflammatory. A DASH diet, so that is an emphasis on low sodium, high fruits and vegetables, whole grains. That can actually lower blood pressure as much as an entire medication within 2 months. Eating a low salt diet, so only having about 1,500 to 2,000 milligrams of salt per day, and cutting out alcohol and tobacco. Eating a high fiber diet, 30 grams of fiber powder or flax seeds can help reduce blood pressure. High fructose corn syrup can increase blood pressure, so limiting that in your diet. Aerobic exercise or weight training 60 minutes 4 days a week can also help lower blood pressure. So cutting caffeine can either increase or decrease your blood pressure, but either way you should switch over to green tea. Small frequent meals has been shown to decrease blood pressure. High protein, about 1 to 1.5 grams per kilogram per day, can also lower blood pressure and act just like an ACE inhibitor. So interestingly, deficiencies in vitamin C and vitamin D can increase your blood pressure. Vitamin B6 acts as a natural calcium channel blocker to lower that blood pressure. You can take magnesium, 200 milligrams per day. It's been shown that low intracellular magnesium increases blood pressure, and about 68% of adults do not get enough magnesium in their diet. You can also take omega-3s, 2.5 grams per day. A deficiency in omega-3s has been associated with hypertension. Lipoic acid is the active ingredient in tomatoes, and so you can take about 600 milligrams per day. Taking lipoic acid with an ACE inhibitor can help protect the kidneys from the damage caused by high blood pressure. 3 grams of melatonin at night can help lower nighttime high blood pressures. Quercetin, 1,000 milligrams per day, acts as a natural ACE inhibitor to lower blood pressure. Coenzyme Q10, 75 to 350 milligrams per day with fatty meals can help reduce systolic and diastolic blood pressures. Hawthorn comes from a tree that contains high flavonoids, so you can take 750 to 1,500 milligrams per day divided in 2 to 3 doses, and this creates vasodilation of the vessels and decreasing that blood pressure. You can cook with extra virgin olive oil, 30 grams per day, and this can be an alternative to butter. You can also use dark chocolate, 30 grams of cocoa every day, to both lower blood pressure. Grapeseed extract, 300 milligrams per day, and sesame seed extract, 60 milligrams per day, can also lower blood pressure. 900 milligrams of aged garlic extract, or 2 cloves of garlic every day, can lower systolic blood pressure by 10 points. 3.3 grams of dried wakame seaweed a day, or drinking pomegranate juice or eating pomegranate seeds can lower blood pressure as well. Focusing on reducing stress through yoga, tai chi, and even focusing on your breathing and reducing that breath rate can all help decrease your blood pressure. One of the most interesting natural ways to treat high blood pressure is something called earthing. So this is where you walk barefoot on grass or on the beach, and this allows electrons to transmit from the earth to your body. And this has anti-inflammatory effects and reduces the impact of oxidative stress on your body. All right, so that's all I have for you guys today. I hope you learned some natural ways to treat your high blood pressure. Please comment below. Let me know if there's been any other ways you've treated your high blood pressure. And check out my description below. I do have a link to competitively priced supplements. You can follow me on Instagram at Kayla Tailored Wellness. And thanks again for watching today and letting me tailor your wellness.